I have always been addicted to drinking milk. So I went down to 1% milk and I try to limit myself to one or two small glasses a day. I also went to plant-based butter instead that I like. And also I use something called RX sugar, which is an allulose. And it's right here. And it's supposed to be low glycemic. It's sugar reimagined, 0 calories, net carbs, glycemic. I use like maybe a half a teaspoon in my coffee. So how about those things? What are your thoughts on? I'd be interested to see what the doctor thought about those.
So just quickly on milk, I grew up in Minnesota, which is a dairy state, and I drank milk with breakfast, lunch, and dinner. And they
Mhm.
served it at school lunch. And later we learned also in Minnesota that dairy fat is a high risk for heart disease. And so once they figured that out, they started promoting skim milk, which I have mixed feelings about. So once you take the fat out of dairy, I think it's healthier, but there's protein and lactose sugar combined in milk. So a cup of skim milk is maybe 90 calories, and you could drink unsweetened almond milk, for example, or cashew milk for 25 or 30 calories per cup. So it has a third of, unsweetened nut milks have about a third of the calories. These are the commercial nut milks, not a homemade nut milk. And they have calcium in it and vitamins. And so I think a glass of milk, like skim milk or 1%, is perfectly fine. I would usually not steer a patient away from having a glass of skim milk a day, but I wouldn't say like 3 cups a day like I used to drink when I was a kid. And, there's something to be said, I think, for these commercial nut milks that are, 30 calories per cup. I think they have a place. So milk's all right.
What about plant-based butter?
Yeah. Well, okay, plant-based butter is healthier than regular butter because of the amount of dairy fat, right? So butter is pure dairy fat, which
Mhm.
clogs up the arteries, no question about it. But these plant-based butters, it matters how liquid it is. And so when it comes to fats, the main thing to care about is how solid is it at room temperature? And that's, I think, the same question as what's it going to do to my arteries? So if a fat is liquid at room temperature, like olive oil, then it's better than a plant-based butter, which is solid at room temperature. And plant-based butter is better than regular butter, but it's not as good as something that's softer or more liquidy, like
Okay.
especially oils. So they make this plant butter by adding like coconut oil, which is, going to be solid or semi-solid at room temperature. Um, so that's how I think about it. How liquidy is it at room temperature tells how it's going to treat your arteries.